Good morning. I'm Colt Gill. I serve as the Director of the Oregon Department of Education and Deputy Superintendent of Public Instruction. Today, I'm sharing news from the Oregon Health Authority that impacts all private and public schools in Oregon. On March 19th, the Oregon Health Authority will lift the general mask requirement for indoor spaces and for our schools. This is an update to what was previously communicated. Originally, the school mask rule was set to lift on March 31st. This date was based on early modeling from the Oregon Health Sciences University that suggested that hospitalizations would fall below 400 Oregonians. New modeling suggests this will occur sooner, by at least March 20th. This is good news for Oregon. We have come to this turning point and transition together. Together, Oregonians have made smart choices, like wearing masks and getting booster shots. These efforts helped Oregon fare better than almost every state in the nation throughout the pandemic, with some of the lowest case rates, third lowest in the country, and lowest death rates, seventh lowest in the country. We recognize that making universal masking is a local decision and will bring additional questions about school operations this spring. Over the past several weeks, myself and other leaders at the Oregon Department of Education partnered with public health leaders at the Oregon Health Authority to hear from local health authorities, schools, and communities to better understand the needs and challenges in our local communities. Here's what we heard. First, our school leaders and local public health officials expressed a strong need to keep alignment between the dates for lifting the statewide face covering expectations in K-12 settings with the lifting of the general indoor spaces masking requirement. So we've aligned those two dates. Second, school and district leaders told us that they can thoughtfully prepare and plan for this transition by March 19th. In most districts, this aligns with spring break and allows for a natural transition and the ability to teach new expectations when students return after spring break. Based on the feedback from local leaders and communities, the Oregon Health Authority and Oregon Department of Education are also partnering to develop practical updates to safety protocols for quarantine, contact tracing, and testing that meet the current conditions of the pandemic. These guidelines will continue to support our North Star goal of providing in-person learning for every student all day, every school day, and will focus on specific supports for students, staff, and families that may be at more risk from COVID-19 than others in the school population. The Oregon Department of Education will be updating and releasing school guidance early next week. With the lifting of the statewide mask requirements, we also want to be clear that many students and staff will choose to continue to wear face coverings at school. And every individual has the right to make that decision, and our schools will support the continued use of face coverings by individuals. In fact, we recommend continued face coverings for students and staff that are at higher risk because they are not vaccinated, that are immunocompromised, or that have underlying health conditions, or staff and volunteers who are 65 and older, or anyone who lives with someone in one of these categories. We will continue to monitor the path of the pandemic here in Oregon, and we will continue to adjust our guidance to prioritize safe in-person learning. I want to close by saying thank you to all of our educators. Without the partnership and tremendous dedication of our teachers, our classroom support staff, our bus drivers and custodians, nutrition services staff and office staff, our specialists, our school and district administrators, and our school nurses, this year could not have happened. We have moved through this new stage of the pandemic, and I know that we will always look back at this time in our history and see our educators as the heroes that they have been and continue to be for our children and families. Thank you.